This discussion is another drug of psychopharmacology, and we will call it as antidepressant. There are classifications of antidepressant, and here are the classifications. Okay, thank you. First, the TCA, the Tricyclic antidepressant. Second is the MAOI, or the Monoamine Oxidase inhibitor. And the third is the SSRI, or the selective serotonin reuptake inhibitors, and other atypical antidepressant. The indication, when to use and when not to use, and under what circumstances shall the antidepressant be given. The following are the list as to when antidepressant is badly needed. And among the list, the high point and the highlight of all would be the bipolar disorder. This is a condition of extreme highs and lows of emotion, the extreme mood swing. And the picture you're seeing right at your right upper screen is a famous actress who admitted in public that she is suffering from bipolar disorder. Other than the bipolar disorder, the foremost condition that necessitates antidepressant is the condition of suicidal ideation. This is coupled with agitation, with generalized anxiety disorder, the obsessive compulsive disease, and even the post-traumatic stress syndrome. So these are all the indications when antidepressant is badly needed. The monoamine hypothesis. This discussion will explain to us why the human brain is suffering from mood disturbances, the highs and the lows. Why do human brains suffer from obsessive compulsive disease, the bipolar, the post-traumatic stress disease, the depression, and even the suicidal tendencies? There are three monoamine hypotheses. And the first theory further explains that depression and other related diseases results from the deficit of the three monoamines, namely the serotonin, the dopamine, and the noradrenaline. So depression further is happening in human brain because there is a scarcity, insufficiency, deficiency, and lacking of all these three neurotransmitter. That's the first theory. The second theory further explains that because of that insufficiency, that depletion will lead to upregulation. This means that the nerve endings will suffer from multiplicity and oversensitivity of the receptors. And this will result to maladaptation and malfunctioning of the neurons. And the third theory of depression is based on the defective gene theory. What does that mean? Defective gene theory explains and suggests that abnormal functional gene is responsible for depression. And so therefore, it further clarifies that depression is happening at the level of neuronal activities. And the medication, the psychopharmacologic medication called antidepressant, will address this problem. We will look into the next slide on how does the antidepressant resolves the problem of scarcity, insufficiency, and deficiency of the monoamines. This is about the contraindication. When not to give this medication, the following are the conditions in cases of agranulosantosis, in cases of severe liver damage, whenever a patient do have a glaucoma, or a male patient suffering from prostatic hyperplasia, and to a patient with epilepsy, and to a pregnant woman who's having lactation, the antidepressant shall not be given. The antidepressant and the mechanism of action. Under the principle of neurobiology, the antidepressants, such as the SSRI, the MAUI, and the TCA, they all come into play with chemical and electrical potential. They are happening in the neurons, particularly in the neuronal synapse. Upon learning, and given that depression is a result of the deficit, meaning there is a shortage, there is an undersupply of the three monoamines. And these three monoamines are namely the serotonin, the dopamine, and the noradrenaline. Now, in this illustration, we will take serotonin as an example, as one of the neurotransmitter that we will show. And the goal of this antidepressant, the medication that we are talking about, is to increase the level of the monoamines. And how is this being done? This is done by preventing the reuptake. Now, let's take a look into how this is happening. Now, you're seeing a synapse, axonal synapse, presynaptic synapse. And down below, you are seeing there post-synapse of another neuron, of a dendrite of another neuron. Within that synapse, there are structures that should be highlighted because of its importance. As you may see, there are a lot of vesicles. The MAO, or the monoamine oxidase, is an enzyme. This is an enzyme that goes together with the mitochondria. And this will play an important role in the role of antidepressant. Much more with the reuptake transport. Take note of this structure because sooner it will play an important role on how the antidepressant works. Now, looking into the consideration, there are, of course, the neurotransmitter, and in this case, we are talking about serotonin. As you may notice, there are only few of the neurotransmitter. And as it is being released, you cannot expect for more because there are only less from the source, which is from the vesicle. Normally, it is expected to bind to the receptor. In the case of serotonin, we have the 5-HT receptor. But in the case of noradrenaline, we have the alpha and the beta receptor, which is not shown here. What happens here is that some of the remaining neurotransmitter that should tend to attach to a receptor are not doing its job, but rather they are being attracted and attached to the reuptake transport. Now, in this case, since there are only few neurotransmitters, some are being attracted and attached and magnetized into the MAO, which is an enzyme. Once these neurotransmitters are being attracted by the MAO, they are being degraded or metabolized. And so therefore, the number of neurotransmitter available in the synaptic clefts is further being lessened. Now here comes the antidepressant. Antidepressant will now play an important role on how this neurotransmitter will now be prevented from lessening in number. Now, here comes an example. In the case of serotonin, we have an antidepressant, SSRI. Watch closely. This is the molecule, and this will attach and bind and block the reuptake transport area. This antidepressant, or the goal of the antidepressant, will be to prevent further reuptake, which will lead to metabolism and degradation of the only few monoamines. And this is how the antidepressant is working in our brain in order to prevent further escalation of depression to suicidal tendencies. Let me present to you the first line of antidepressant, and they are called as the SSRI, or the selective serotonin reuptake inhibitors. At the left, you may see that these are very unfamiliar names to you, but from this time on, you have to know them. Going to the right are their forms, whether they are available in capsule, in liquid, or in tablet. In the middle, you will see their daily dosage in milligrams, and at the extreme column to the right is their extreme dose ranges. SSRI. To help you commit the names of these drugs to your memory, let's resort to what we call the mnemonics. Let's use these mnemonics: effective for sadness, panic, and compulsion. When you are confronted with the questions of trying to recall the name of SSRI, I want you to remember this child. This child is having sadness, panic, and compulsion. He's keeping his both hands inside his pocket. Now remember this child if you are confronted with what are the drugs of SSRI. Let's see how it works. Effective for sadness, panic, and compulsion. I want you to look at the first letter of each word. E will remind you of escitalopram. F will remind you of fluvoxamine and fluoxetine. Sadness, S will remind you of sertraline. P will remind you of paroxetine. C will remind you of citalopram. This in any way will help you remember, if not memorize all of them. Now, let's take a look at the side effects. This is another pressing situation. For SSRI, I want you to remember Grandpa. Grandpa is a pensioner of SSS, but he is getting more than, because it's more than 3S. Now, let's see how it works. The first S is about stomach upset. Every time you're taking SSRI, it's possible that you will be having hyperacidity. The second S is, of course, Grandpa is old. He will be suffering from sexual dysfunction. And the third S is about serotonin syndrome. This is an excessive serotonin in the body. And the last S is a possibility that when you take SSRI, you will suffer from suicidal thoughts. Hope this helps. And here's for the list of tricyclic antidepressant. There are too many to recall. At the left are the names: imipramine, desipramine, amitriptyline, nortriptyline, doxepine, temipramine, propytyline, mapotylene, mirtazapine, amoxicillin, and clomipramine. What if you will remember these mnemonics? I am depressed, close no door. Again, I am depressed, close no door. That would stand for I is imipramine, A is for amitriptyline, D is for desipramine, and C is for clomipramine, N is for norepinephrine, and D is for doxepin. TCA as antidepressant. This kind of antidepressant is for endogenous depression, meaning if you have an underlying depression, it will be more triggered, and that's why you need a strong antidepressant. Also for reactive depression, that is for a situational depression. And if your depression is brought about by alcohol and cocaine withdrawal, then TCA is the right meds for you. And here's some more. TCA meaning tricycle. This is another way for you to remember it easily. You have to write a tricycle, and that will get rid of your depression. And by having the tricycle, these are the most commonly used TCA, the amitriptyline elevil, doxepin sine qua non, nortriptyline pamilor, and imipramine topranil. And here are the other compounds that are being used as an antidepressant. Their names are at the left, and I want you to remember three of the most important other compounds there, namely the bupropion Wellbutrin, the banlapacine Effexor, and nefazodone Zerzone. Here's why. These three drugs from other compounds are those drugs that are preferred for clients with high risk for suicide, and these are favorite drugs for board questions. Let's talk about Maui. We will classify this drug as to one, the selective type. Selective because it only inhibits the dopamine as a monoamine oxidase B. This includes the selegiline, rasagiline, and another important consideration other than antidepressant, it also works as an anti-Parkinson drug. Now, another classification is the non-selective MAUI. This is non-selective because it inhibits monoamine A and B. That includes the three monoamine, the serotonin or epinephrine, and the dopamine. And also, drugs under the non-selective category may include isocarboxacid, the phenelcine, and ratanilcypromine. This non-selective is irreversible MAUI. And here's to Maui. If you want to easily remember this, try to recall the movie Moana, where there are a lot of songs, music, and dance. And at this point, you can remember the Maui by words that rhymes, such as by saying Marplan Nardil Parnate, Marplan Nardil Parnate, Marplan Nardil Parnate, and that will appeal to your memory. Again, with Maui, this is the drug that has a lot of precaution and restriction among the antidepressant. As you may see in the picture, side effects may include sweating, tremors, dizziness, and increased blood pressure if you happen to have a drug-food interaction. As you may see, there must be no aged cheese, no pickles, no cheese, no wine, for the reason that tyramine will degrade the enzyme MAO. And at this point, it is possible that the patient will suffer from a dangerous fatal condition called hypertensive crisis. Other than the food, there is also a fatal drug-drug interaction with MAOIs. Such drugs may include SSRI, the certain cyclic compounds, the buspirone or the buspar, the dextromethorphan, the opiate derivatives, such as the meperidine, and not only that, other drugs may also include the barbiturates, the TCA, antihistamine, CNS depressant, and antihypertensive and over-the-counter cold meds. Again, among all the antidepressant, Maui is the most restricted, is the most having the most precaution drugs. When a patient is taking Maui, there must be indeed a great precaution, especially in the food intake. Tyramine-rich food shall be avoided, or else the patient might suffer from what we call the hypertensive crisis, which is fatal, life-threatening, and the following condition may happen. Hypertensive crisis is being defined by a sudden rise in blood pressure that may lead to the following condition: heart failure, eclampsia among pregnant, pulmonary edema, stroke, and even confusion. That's why for nurses, you have an obligation for health teaching and to remind the clients to avoid tyramine-rich food. For what reason? That is to avoid hypertensive crisis, which is deadly and fatal.